Now they chop iron for gym, so make una dey work on una prick. Make una dey work on una prick. No be say you go dey carry iron, dey chop iron, your prick dey shrink, dey go. See you, oh, they go cheat on you. See you, your prick, your prick dey go, they get complain, oh. They complain, oh. The people they complain, oh. 2 minutes man now. Akpobi go full everywhere, your hands go swell up, wetin dey happen, you go big for up, tiny for down. Your prick dey shrink, oh.
Hi guys, Dr. Franco here. How are you doing? Okay, a little backstory here. This young chap I met in the gym is my friend's son. He's about 20 years old. I like the way he works out, very effectively and diligently, and I keep giving him the thumbs up. Like, boy, man, you're doing well. So one day his father, whom is my friend too, sent me this video, and he was like, he has heard this thing before, that his son is always exercising, that too much exercise should not go and destroy his son's manhood and erection and all of that. So I took it upon myself. I deemed it necessary to be able to make some clarity on this issue. Now, exercise, frequent workout done moderately, can actually boost testosterone, can actually increase sex drive, and can actually make someone's erections more powerful. The problem here now is when there is overtraining. There's something called overtraining syndrome. There's some people that say, there's some buff boys that say things like no off days. No, you gotta have off days, man. You gotta have recovery period. Now, when I say overtraining, I mean extensive and long training, sometimes twice in a day, probably with poor sleep. You're not getting as much as 6, as in you're getting less than 6 to 7 hours sleep in a day. You're not probably getting the right micronutrients, the right protein, and even the right carbs, and these things can actually affect the way the stress hormone works, because the stress hormone now spikes. The stress hormone, I mean cortisol. Cortisol now spikes, and testosterone gets reduced. Testosterone is the male hormone that makes a man, makes a man have erections, deep baritone voice, and everything, for the people who don't really understand this scientific terminologies. Now, it's quite unfortunate that the people that she might have encountered, that they were buff, they were jacked, they were Applebee's, but unfortunately, maybe they failed to satisfy her in the other room. Now there are some things that may cause this. Some people who, particularly amongst competitive bodybuilders or people who are obsessed with having big muscles, they take steroids. When you take steroids, it actually can reduce the size of the testicles, causes what we call testicular atrophy. That is because the testosterone you're taking now reduces the testosterone formation from the testes, so the testes become smaller, and that can of course cause low sex drive, erectile dysfunction, and low sexual mood and performance. Some of these competitive bodybuilders also take things like human growth hormone, insulin. Human growth hormone could cause diabetes. Insulin could cause hypoglycemia, and all these things coupled together, could actually hamper a man's sexual performance. Now, there are other things now that can actually cause a man to have low sex drive. I'll call it ED, erectile dysfunction. Psychological. What if the guys go? What if the people she encountered had depression? What if they had some kind of stress disorder? Maybe financial stress. Maybe they might have had some kind of anxiety disorders. There's something called performance anxiety, which is when you try to have sex, maybe one time and you didn't perform well, and you have this fear that you might not perform well subsequently, and it's just like a negative feedback. It just impinges on the mind. Those are psychological things that can cause a man to have erectile dysfunction and poor performance. Also, some diseases like hypertension, diabetes, heart disease that blocks the arteries, thereby reducing the blood flow. They can cause erectile dysfunction. Some medications, the most common medication is alcohol. Overconsumption of alcohol can cause erectile dysfunction. Some people take drugs for hypertension. Maybe the person is hypertensive. Some people take drugs for anxiety-related issues that may diminish a man's sexual performance. So I'd like to emphasize very clearly that exercise done moderately with adequate recovery and rest is actually a booster to sexual performance. It is when there are other scenarios involved, like all these things I've mentioned, that may make the guy not to satisfy you, my dear sister. I'm quite sorry about that. Okay, so some people may want to ask, what about creatine? Creatine is widely marketed and publicized. Creatine is the most extensively researched supplement. Its advantages are immense. It helps physical performance in exercise. It helps with recovery, and it even helps mental sharpness and cognition, and I'll state it very clearly, creatinine has been studied not to have any effects on a man's sexual performance. So in summary, exercise in moderation works well. Rest and recovery goes a very long way. The use of exogenous steroids and all these other drugs I mentioned and conditions I mentioned may have caused that. All right, I believe I've been able to express myself scientifically. Thank you and have a pleasant day. Dr. Franco, peace out.